The Virginia Center for Health Innovation has commissioned students from the VCU MHA and William & Mary MBA programs to develop a challenge that can be used to encourage innovation in healthcare and wellness in the state of Virginia. The following plan targets employer-based health incentive programs and the use of mobile technology to encourage and facilitate active employee participation. It was developed by Carrie Gilmore, Laura Lee, Ankur Patel, Catherine Pierce, Divya Singla, and Andrew Spicknell. For decades, many employers have provided health insurance benefits to their employees. In recent years, many employers have also offered wellness programs to their employees. These programs are designed to incentivize employees to actively improve their health, ultimately lowering the cost of premiums to both the employer and the employee. As premiums are increasingly being shifted to employees, enrollment in wellness programs that offset these costs has become common. With the increasing accessibility to the internet through personal and mobile devices, healthcare applications have gained popularity. The value of these applications is increasing as pressure for a shift from episodic care to health maintenance builds. Pairing this accessibility and pressure with reducing rising premiums offers a unique way to target a population and achieve the triple aim of lowering costs, better outcomes, and overall increased population health. The topic of this innovation theme is one-year employer-incentivized additions to employee wellness programs that focus on mobile applications and web-based tools to assist employees in managing chronic conditions, making value-based medical decisions, and monitoring other health needs. The populations who would benefit from this innovation challenge are employers and employees who are currently participating in organizational wellness programs or who are interested in starting one. One of the main benefits of this theme is that it actively addresses ongoing individual wellness goals. It does so by providing a platform for benchmarking, educated decision-making, and continuous care for employees. This theme incorporates information technology by utilizing applications and web-based tools to help employees gain a more in-depth understanding of and make better decisions about their overall health and wellness needs. The audience of prospective innovators who would be invited to this challenge are employers, regardless of industry, which currently offer wellness programs or who are interested in starting a wellness program. The incentives for employers to participate in this challenge are to facilitate the implementation, maintenance, or furtherance of a wellness program, to assist employee participation in wellness programs, and to achieve and take advantage of the benefits of a more healthy and productive workforce. The deliverables to be submitted by participants include an initial plan to implement health tools, including a description of the different technologies and resources used, description and evidence of implementation, advertising, and incentivizing processes, reported levels of employee involvement or utilization of the tools, periodic assessment based on appropriate metrics, and a final review of the overall success of the program. Intellectual property requirements and assumptions are minimal, but would include acknowledgement of use of any purchase applications, programs, or software to facilitate the wellness programs. Performance criteria would include measurements of percentage of employee involvement, variety of resources available, and evaluation of the strategic use of incentives to encourage participation. The process of grading and ranking will be based on two prize categories: improvement of or incorporation into an existing wellness program, and incorporation of a new wellness program. The reason for having two categories is to remove the advantage of having already begun a wellness program and to encourage participation among companies without an existing program. Grading would be based on data about employee participation and resources used, an assessment of incentive initiatives, and qualitative data derived from employee responses to surveys about the use of the program. The key advertising points for corporate wellness plans in general are decreased healthcare costs and the benefits of having healthier employees, such as decreased sick days and potentially higher productivity. The key advertising points for IT incorporations into a wellness plan are that this provides easy methods for employee involvement and facilitates healthy living by having easily accessible resources. And it can also create a sense of competitive camaraderie, for example, by allowing individual benchmarks to be made public. The methods of marketing and communication that are recommended for this challenge are utilization of the Virginia Health Innovation Network website and attending and advertising at conferences to generate awareness about the website and the challenge. As this is a proposal for a year-long challenge, there are several milestones that may be used to keep participants on track and successful. The timeline is flexible, but in general there are 4 main phases that can be used as milestones. The first is the submission of the program plan. This should include a summary of the program details, ideas for employee engagement, and an incentive structure. Next, participants should have evidence of successful implementation. This can come in many forms, but it is recommended that companies report a summary of plan benchmarks and a process for continuous review. After implementation, participants should have a system for quantitative and qualitative assessment. There may be a standardized review process as part of the challenge, or participants may be allowed to design their own process. It is important that the system includes both employee feedback as well as general statistics and engagement metrics, including health goal attainment. At the end of the year-long challenge period, there should be a final program evaluation and review based on the success of each participant's wellness program. This should include a plan for ongoing assessments and revisions to the program, and a final end date if applicable. Health systems and other organizations would be the primary beneficiaries of a healthier population, therefore they should be the sponsors of this challenge. This challenge may also help to fulfill health system requirements for meaningful use by facilitating employee use of technology like the patient portal. The framework for assessing the return on investment for this challenge includes measurements of the number of used employee sick days and days of absenteeism, as well as individual employee health metrics and outcomes, turnover and vacancy statistics, and general healthcare claim statistics. The relevant innovation portfolio items that are addressed by this challenge are patient-centered care models, employee health, and productivity measurement. This challenge addresses the growing shift from episodic care to health maintenance through employer-based wellness programs. Recognizing most employers will continue or begin providing insurance coverage in the coming years, this challenge offers incentives for employers and employees to engage in preventative behavior to lower health costs and achieve improved health outcomes. Through using mobile or web-based applications, individuals can use existing tools to better monitor their specific health needs in a way that best suits them. By allowing individuals to determine the appropriate applications, individuals can focus on issues such as chronic condition maintenance, medication compliance, dietary restrictions and tracking, or value-based medical decisions. It is necessary to engage employers in this initiative since ultimately they are the primary purchaser of healthcare services and can leverage and incentivize their employees to participate. Through mass participation, employers and employees can lower costs, providers can ensure patient compliance and improved health outcomes, and communities can experience greater overall population health. This concludes the presentation of our Innovation Challenge Plan for the Virginia Center for Health Innovation.